Let's talk about informatics. Informatics is a way of thinking and applying data information, not just an application of information technology or information science. Informatics concentrates on optimizing interactions of human behaviors and their surroundings to achieve efficiency and innovation, a transformation of information to improve the quality and effectiveness of care without sacrificing security. Notice this right here, the $60 million that's lost in fraud. From an entrepreneurial standpoint, a change in government policy could prove lucrative for someone like yourself that's business-minded. So informatics is being used for Medicare fraud. From an entrepreneurial standpoint, again, this is an opportunity. Remember I showed you $60 billion is lost annually from fraud. What if you created a startup company and you earned 1% of that money recovered? Just do the math on $60 billion if you earned 1%. Health informatics is taking advantage of machine learning, which is an extension of artificial intelligence, using complex statistical analysis to identify patterns in data. For example, computerized physician order entry systems can detect if a drug interacts with another drug a person is taking, if a drug is too large for a patient's weight, if a drug might interfere with a patient's allergies. Informatics is leveraging the power of information and knowledge. You may recognize this building. Most healthcare improvements are collaborative efforts, and biomedical engineers play an important role. The same applies to the classroom, which is why biomedical engineers are always welcome to join this class. They provide a different perspective, which is helpful to medical students and nursing students, as well as business students and other disciplines. Understanding how a device works can be particularly helpful to someone that's working with that particular device. There are numerous examples in the hospital of biomedical applications, from defibrillators, EKGs, medical imaging, pacemakers. Biomedical engineers work closely with patients and engineers from multiple disciplines to develop and refine their innovations, which is why when we bring biomedical engineers together with health science students, it is so effective. So let me give you an example here of a oxygen control knob. So imagine you're a nurse and you're turning the knob and it rotates smoothly, suggesting that the oxygen flows at all points on the knob. But in fact, the oxygen flows at specific designated flow settings. Think how valuable it is to be able to understand and explain the mechanical properties of a needle valve. The bioengineers can benefit from working with the nurses, and they can redesign the product so that it has an audible click or a tactile feel, which ultimately could reduce patient errors.